appears Republicans have renewed their assault against what little healthcare reform we have. Yes, it appears that Republicans are going after the Affordable Care Act. Oh, what is this? 2010? Well, look, it's not Republican politicians this time that are going after it, but right-wing groups that are looking to use the Supreme Court to strip away certain mandates. In this case, the preventative care mandate inside the ACA. So now a lawsuit launched by conservative, evangelical right-wing groups is challenging the Affordable Care Act's requirement that insurers and groups and group plans cover dozens of preventative services at no cost. A group of Texas residents and employers, of course, Texas, represented by attorney Jonathan Mitchell, who gained prominence as the former Solicitor General of Texas, and the person who had the chief architect of the state's draconian 6-week abortion ban. He is out there representing these evangelicals, these far-right Christian extremists, in their attempt to gut preventative healthcare services. Jeez. All right. Now, they are claiming that the ACA's preventative services mandate violates their religious freedom. Oh. The plaintiffs are claiming that the law violates religion because it forces them to, quote unquote, subsidize or provide insurance that encourages and facilitates homosexual behavior, drug use, and sexual activity outside of marriage. Wait, I thought they were part of your freedom. No, they're showing you exactly who they are. Here's more homophobia. And using that to come after your insurance. Now, the lawsuit states the government cannot possibly show that forcing private insurers to provide PrEP drugs, the HPV vaccine, and screenings and behavioral counseling for STDs and drug use free of charge is a policy of such overriding importance that it can trump religious freedom objections. Yeah, how about, healthcare? Having people not die or spread these diseases, protecting national health. That's kind of more important than somebody saying, "Oh, I don't feel good about gay people getting health care." I mean, that's disgusting. Now, the lawsuit also says the government cannot possibly I already said that. Sorry. Look, let's make no mistake. Not about religious freedom. This is actually mainly, I think, about corporations not wanting to pay for healthcare. I mean, that's the big thing, but also these Christian fundamentalists trying to basically take over your life, trying to control your life. Now, look, Mitchell is looking to block the ACA's entire preventative care mandate, not just the specific drugs he talked about, which is going to save corporations, I guess, a lot of money. They don't want to pay that. Now, an estimated, of course, 151.6 million people with private health insurance are right now able to get free preventative care, ranging from colonoscopies, mammograms, to flu shots, birth control, and depression checks through the ACA. Studies have shown that the elimination of this patient cost sharing has reduced racial disparities in the use of preventative care. So if it helps Black people, of course, they're also not in favor of it. The far right says, no, we don't want you to have free preventative care. We want you to pay. We want you to pay. It's disgusting. Now, hearings in the case began on Tuesday of this week. Unfortunately, you had Judge Reed O'Connor, the author of numerous anti-ACA rulings, including a 2018 one deeming the program unconstitutional, presiding over the affair at the U.S. District Court for the Northern District of Texas. So, congratulations. In an analysis published on Monday from the Urban Institute, they predicted that a ruling on the behalf of the Christian plaintiffs from Texas could undermine access to health care for nearly 168 million people on employer-based plans for the ACA's individual market, which has medical organizations that are giving dire warnings of what's to come. A joint statement led by the AMA and signed by 61 groups said this, quote, with an adverse ruling, patients would lose access to vital preventative healthcare services such as screening for breast cancer, colorectal cancer, cervical cancer, heart disease, diabetes, preeclampsia, and hearing, as well as access to immunizations critical to maintaining a healthy population. Our patients cannot afford to lose this critical access to preventative healthcare services. Rolling back this access will reverse important progress and make it harder for physicians to diagnose and treat diseases and medical conditions that, if caught early, are significantly more manageable. Now, I think that's the important part, because yes, if you catch something early on and you can treat it more cheaply than if it's caught later on where you need much more expensive medical interventions. But again, those more expensive medical interventions just happen to make people money. So of course, they're like, yes, let's make sure people have to pay more so that our donors can get rich. Now, look, this is who the Republicans are, okay? As I've said before in the show, they're not conservatives. They're regressives. They're trying to take us back. They're trying to roll back any sort of progress, especially if it has to do with the Obama administration, right? And the ACA was passed under Obama. And so they're rolling back any progress, but they're actually rolling back even more. And look, the ACA, as I've mentioned, has a lot of flaws. I don't think it's nearly progressive enough. I think it's too little, and I think it was passed too late. At the time that they were trying to pass this, we should have had at least a public option, and we should have Medicare for all. We should have single-payer health care like every other modern industrial country, where they have healthier people and they have real health care. But even with what we have, which is just private insurance, too much for regressives. They have to take away what little progress there was. And look, you want to talk about being pro-life. They claim to be pro-life. They're not. These people want you to die if you can't afford health care. Simple as that. And again, preventative services, as I mentioned, they save money in the long run. Now, there's another group here, Syringe Access, which is a coalition of harm reduction groups. They went after this on social media, saying, quote, there is no religious freedom justification for stripping healthcare plans of their responsibility to provide free PrEP and STI screenings. This is just thinly veiled homophobia, anti-drug user sentiment, and raging contempt for public health. Now, let me just add, before I get into more of that, what did we just hear Marjorie Greene talk about? Monkeypox, right? And how, and I've seen this across other conservative, pages and outlets talking about how, monkeypox, that just affects gay people. They're basically reinventing the AIDS crisis here by saying, that's only going to affect gay people. And now we have these organizations saying, we don't want gay people to have access to preventative care because we don't like their lifestyle. So it is absolutely not just thinly veiled homophobia. It's right up in your face. Total homophobia. Now, getting back here to another couple of quotes here. Catherine Hempstead, senior policy advisor at the Robert Wood Johnson Foundation, told Politico, any of the requirement that preventative services be free to patients will have negative health and financial consequences for millions. According to Politico, the Biden administration is also arguing that Texans do not have legal standing because they aren't being harmed by their insurance covering preventative services, and that there's a clear government interest in preventing the spread of HIV and STDs for the health of the population at large. Fair enough. But nonetheless, I'm going to show you what the real plan is. But before I say that, I've got to mention the Trump administration was also a big supporter of PrEP as part of the plan to end HIV. said a senior attorney with the National Health Law Program. It's something we've had bipartisan support for. This is trying to turn the clock back to 1983. Well, as I said before, Republicans are regressive, which means they don't want to just go back to 1983. They want to go back to 1583. What's sad is that this might be successful because it's expected by legal experts that the case will be appealed to the U.S. Supreme Court of Appeals for the Fifth Circuit. Now, that circuit is stacked with far-right justices appointed by Trump, and then to be appealed to the U.S. Supreme Court. What do we have on the U.S. Supreme Court? Oh, right, extremists. We have Christo-fascists that are sitting on the Supreme Court right now. And they are extremists, and they'll absolutely, if given the chance, roll back these vital protections.